Hello, my name is Khadija Erickson. I come to you with many titles, but the ones I'm most proud of are Executive Director of the Mid-Michigan Tenant Resource Center and Housing Chair for the Lansing Branch NAACP. You've heard a lot today about people doing similar work to I primarily work in the urban core here in Lansing, but I also go out into rural areas. My organization is primarily funded to serve Ingham County, but I serve people statewide thanks to unrestricted funding I received to be able to do that. What I'd like to use my time to speak with you about is what it's like on the street to do outreach. My organization dedicates one night a week to go out and do outreach, and then we do on-the-spot outreach as it comes throughout the day. What I have noticed over my years of doing outreach, whether I was employed or doing it for the love of the game, is that it is increasing over time. More and more people are not able to get over the hump of an eviction. An eviction has always been an issue to have on your record. Even a summons can blacklist you from housing. But what we're seeing is landlords are less willing to work with tenants who maybe have an eviction on their record or even just a summons. And so that's leading to more people existing in homelessness, whether that is for a very short period of time as they're able to kind of get things together and go back into housing. That's happening less and less without help from outside agencies. So what that has meant for me is that I'm seeing in my professional work a record number of people out on the street. The day after Code Blue ended in Lansing, we saw 116 people on the street. Those people did not exit the warming shelter and go to emergency shelter. They went to the streets and set up campsites in places we normally don't see them, in parks that were very open and exposed because that's where they could be. Part of the reason is that the way the city handles camp evictions. When the city of Lansing discovers a camp anywhere and there happens to be any greenery or things of that nature, what they'll do is they'll clear cut the area to make it less enticing for those people to return to, which has an added effect of disrupting our urban canopy, right? It is going to create hot spots throughout the city because there is no tree cover anymore. That also means that those people are picking different spots than they normally would have so that they can maintain contact with their caseworkers, be close to services like the hospital, caseworker, mental health, you name it. And so that's where they have to be. When we talk to people about why you are not engaging with the emergency shelter, we're hearing a myriad of things. They've been rejected because of the medical equipment that they have. They need a caregiver and they're not able to have them there, especially if it is their loved one. A lot of people who are LGBTQIA either feel unsafe engaging with the shelters, have been told they need to engage with religious services in order to be at the shelter, or were outright rejected because of their gender expression or because of their lifestyle. Additionally, we are seeing a lot more middle-aged and elderly people existing on the street. That has a lot of issues that coincide with that because people's health is not really helped by existing on the street. We see downturns in mental health, and so increased instances of anxiety and depression being expressed by people we talk to, including people who are experiencing and experimenting with drug use for the first time to deal with the trauma of living on the street. And I actually love the speakers before us who pointed out to you correctly, drug use follows homelessness, not necessarily something that is always preceding it, right? There are more young people that I'm encountering between the ages of 18 and 24, even younger than that. It is a dire situation for people. A lot of the folks are employed, but they cannot afford the housing around them. And then a lot of the people, if you can believe it, started their homeless journey because of COVID. Dietrich Encampment in Lansing, a vast majority of the 70-odd people that called that place home lost their housing in 2020 and were never able to recover it, right? They experienced eviction, maybe their home was red tagged during that time, they lost their job, they couldn't pay rent, and now they're on the street. And then on top of that, I want you to understand that we are compounding trauma for people we expect to return to society, right? When we go to where they are living and destroy their homes, destroy their possessions and their belongings, and then tell them to go engage with the services, that is not a real ask. That is not real, okay? And then when there's no protection for them because they cannot be in the shelters because they've been banned, their medical equipment, they need a caregiver, all the things I just told you, there's no place for them to be. You asked, where are we sending people? We're just sending them to the next spot to kick them out from, right? And so what is happening, especially in Lansing, and that's what I'll speak to because that's where I'm doing the vast majority of my outreach at, it is roughly the same 80 to 100 people experiencing camp evictions, and these are violent acts committed against these people where their property is destroyed, medical equipment is ruined, medication lost, documents that they accumulated while working through programs are destroyed. We are committing real violence against our neighbors and then telling them to access housing and come back to us, the same people who are casting them aside like trash. And so what I would like to put forward to you is that it is incredibly important that we take housing seriously and engage more with preventative measures. The more people we can preserve the housing for, the less people will be on the street, right? The less people who are experiencing the repeated trauma of a camp eviction or the rejection after doing what they were told to do to seek shelter because of how they are existing in the world. It's so important that we are not just focused on development, but we're focused on rehabilitating existing housing so we can bring that back online. It is so evident when you look around Lansing, there are a ton of empty houses that we could be putting money into so that it is available for people who are able to rent. It's also important that we are funding these programs. We are experiencing massive attacks from the federal level that is going to cause major disruptions for our homelessness management system. If we do not provide stopgap funding at the state level to continue access to HMIS so that we can continue collecting data, see how our work is working, who we're servicing, where are our gaps, and where do we need to put our money at, we're going to be in a world of hurt, okay? And if we don't also invest in street outreach, which when you review the Michigan Homeless Study from 2023, street outreach was the only method of reaching the unhoused that produced statistically relevant numbers of getting people from the streets to housing, right? So I encourage you to read the GAP report. It's incredibly illuminating. Please go back and read the Michigan Homeless reports if you haven't. If it's been a couple years, please go back and refresh your memory. The roadmap already exists. The studies have been done. I've talked to y'all many times. So we understand the roadmap that we need to be taking, and it's multifaceted so that we are covering as many bases as possible. There will be people who still fall through the cracks because it is just an expensive issue to solve, and we're not superhumans as much as we try to be. But we must try and ensure that at the state level, we are doing everything we can to try and plug up those gaps so that what we have can function at its capacity and have a chance of functioning better in the future.